I have taken flu vaccine once. Do I still need to take it again? Does everyone need flu vaccine? If so, then why is it advised annually and which vaccine to take, when to take? There are so many such questions with respect to flu vaccination that we have in our mind. So hello friends, I am Dr. Piyush Chaudhari bringing to you the next video on the YouTube channel of Fever Care Center for Infectious Diseases. In this video, we are going to discuss in brief about flu vaccination and which vaccines do we need and why. So basically, flu, as we commonly call, is an infection which develops because of influenza virus. Now, this virus has been known to mankind for centuries, and it has caused 6 to 7 major pandemics in last 1.5 century, as is known to us. The latest pandemic, as we all know, took place in 2009, whereas the most deadliest pandemic related to influenza ever was in 1918-19, where more than 500 million people were affected and more than 5 to 10 million deaths were reported globally. In fact, before the COVID-19 pandemic, it was thought that the next major viral pandemic to affect mankind would originate from the influenza viruses. Now, why is it so? And what are these different influenza viruses? Is it that we are talking of H1N1 influenza or the swine flu, or is it H5N1 or H3N2, avian flu, etc.? Now, to just tell you briefly about all these terminologies, basically H represents hemagglutinin and N represents neuraminidase. So these are the two antigenic proteins on the surface of these influenza viruses which lead to their recognition by the human immune system, and then the immune system reacts against these viruses if it is primed against that particular antigen. Similarly, these are the antigens which also cause various pathophysiological changes in our body, leading to the signs and symptoms related to flu. Now, in this H and N, as we call them, there are various permutations and combinations which give rise to these different viral strains. Now, this influenza virus, which may be in humans or animals like pigs, or in birds, as we call it avian flu, they have two important antigenic characteristics: the antigenic drift and the antigenic shift. So basically, antigenic shift is said to take place when two entirely unrelated and different influenza strains come together, either because of poor circulation in the same animal or in the environment, and there is a drastic genetic change leading to formation of an entirely new variant of influenza virus. Now, this process takes place every few decades, and in fact, after the 1919 pandemic of influenza, there have been 3 other pandemics before the 2009 pandemic, wherein entirely new variant virus came in, and because the humans were not exposed to that new variety of virus, the disease caused is on a large scale. Crores of people get affected, lakhs of them may succumb to that infection because our immune system is not previously exposed to that particular variety of infection. Now, after such a thing, there is second property called as antigenic drift. So just a slight change in the genetic structure of the virus. So such antigenic drift or slight genetic mutations, they take place every year. So even if, for example, the pandemic 2009 H1N1 influenza parent virus is same, there can be slight genetic variations called drifts every year, leading to slight changes in the viral genetic structure. Therefore, even if someone is vaccinated against flu in a particular year or has suffered from clinical or subclinical infection, that person may not be adequately protected from the new strain of that virus where there is an antigenic drift. And this antigenic drift occurs in all types of influenza A viruses, also the relatively milder influenza B virus. So this influenza B is the one which typically causes seasonal flus and which usually does not show the property of antigenic shift, but drift is seen in each one of them. So therefore, after those prior pandemics almost a century back, there is something called as Global Influenza Surveillance and Response System. So that's a network of virological laboratories across the world which studies the most common influenza virus strains that are prevalent in circulation in various countries across the world. And accordingly, every year this information is used by organizations like CDC, WHO, and various nodal laboratories in each country, and then that is utilized to manufacture the new vaccine every year. Now, such a vaccine typically in a country like India becomes available in months of April, May, and we use what is called as Southern Hemisphere formula of influenza vaccination. So the latest one for 2024 includes the H1N1 2009 pandemic virus variant. Second is H3N2, and the other two are influenza B viruses. Now, which strain of each of these, that changes every year. Secondly, about the timing. So basically we are clear that everyone requires the shot annually. Now amongst this everyone, highest priority is for the people who are at higher risk of catching the infection, or the ones who are at higher risk of getting complications out of this infection. So complications obviously like pneumonia, acute respiratory distress syndrome, extreme breathing difficulty, requiring hospital ICU admissions, at times ventilators, and sometimes even leading to death. Now, which are these groups? So, small children, of course, elderly people above 65 years of age, and throughout the age groups, anybody who has diabetes, hypertension, chronic lung, liver, heart, kidney, or neurological diseases. Also, pregnant ladies, then patients who have cancers or who are on cancer treatments, and patients who have undergone organ transplants wherein their immunity could be weaker. So these are the high risk and high priority groups for vaccinating against flu. Additionally, close family members of these patients should also get vaccinated, because the patients may catch infection from one of their close family members or close contacts. And more importantly, all these high risk groups, I mean, why we need to vaccinate even the ones who do not have this high risk is because the ones who have high risk and compromised immune status may not mount adequate immune response even after getting vaccinated. So their immunity may still remain weak against the influenza virus. So everyone around them from whom they can catch infection should ideally also be vaccinated. Therefore, in ideal case scenario, it is universally recommended for everyone. Now, when to take? So in a country like India, where the virus is in circulation throughout the year, but we see two predominant peaks. One is during the peak of monsoon, so between July till September, and one peak is during the peak of winter, so during somewhere like December January period, or up to February at times. So because there are two peaks, the ideal time to get vaccinated is in the pre-monsoon period, and also the vaccine is available in April and May. So ideally we should be taking it in May or early part of June, because after getting vaccinated it takes at least 2 to 3 weeks for the antibodies to be generated in our body sufficient enough to fight against the infection. Now, the most important question which is there in everyone's mind: can I not get infection naturally to get the immunity? Well, that is not so much affordable, because it can cause disease anywhere ranging from a subclinical or asymptomatic disease till a severe pneumonia requiring ICU admission and at times putting our life at risk. And this may happen in even in some cases in people who have supposedly normal immune status. So even if you feel that I am young, I don't have medical problems, I don't need the flu shot, that is not so. We have seen many even young, relatively healthy people having extremely severe diseases. So getting infected and then getting immunity is like letting the enemy enter your country and then making your army ready to fight the enemy. Secondly, is the vaccine 100% efficient in that case? Well, the answer is no. But like in case of most vaccines that are ever produced, the efficiency is upwards of 80 to 90% in preventing the complications, and around 75 to 85% in preventing incidence of catching infection. So even if someone happens to catch infection after being vaccinated, at least the infection is much milder and complications are much less likely in such a person who is vaccinated compared to someone who is not vaccinated. So to summarize, We need flu vaccines every year. The latest strain is informed to the manufacturers every year through the Global Influenza Surveillance and Response Network. Ideal time in India is in pre-monsoon. One shot is required annually, and vaccine does prevent complications related to influenza. So friends, if you found this video useful, please share it with as many friends and relatives as possible. Subscribe to the YouTube channel of Fever Care Center for Infectious Diseases. Don't forget to put in your comments related to our videos or what topics you would like to hear. And always remember, stay informed to stay healthy.